In other developments, the United Nations will today observe World Suicide Prevention Day in light of this global initiative and in response to the unfortunate increase in learner suicides. The Gauteng Department of Education is unveiling a plan to deal with this. This comes after more than 14 cases of suicide attempts among learners in a period of a month at Sakane Secondary School in Ekurhuleni. MEC Sholwana will also update on learner placements in the province. Zola Sholwana is in Marshalltown, Johannesburg, with a preview of what to expect. Good morning, Zola.
A very good morning to you, Dudu, and thank you very much. You would understand that the area of Sakane in Ekurhuleni has been affected by a scourge of suicides, and the Department of Education has then, worked together with relevant stakeholders. Previously they actually facilitated a meeting, to speak to all the relevant stakeholders. You're speaking about the SGB and also the CEO of Pulusong Hospital to basically come up with a solution to this issue of suicides. As it has been seen as something that has been quite unusual, especially if it is happening in, one area and affecting, one particular school, which is Sakane Secondary School. You'd remember that we have had an interview with the mother of a 15-year-old who allegedly ingested rat poison. And obviously that has become, a concern and has drawn a lot of attention. Now today, the MEC, Sholwana, will be, speaking, and we are told that there's going to be relevant stakeholders as well, other departments, and I'm joined by the spokesperson for the department, Mr. Steve Mabona. So thank you very much for your time. Obviously, this is a positive step towards, dealing with the issue of suicide cases in schools.
No, thanks very much. We couldn't have done this at any other day. As you know that today is the World Suicide Prevention Day. We couldn't have chosen, any other day because we feel that we need to make sure that the messaging is quite, concise, and we just need to focus on, school safety. Not only focusing on suicide, but we felt that, the challenge that we are facing, most especially in Ekurhuleni and some, part of Tshwane, is quite concerning. So the MEC will be outlining the safety plan, looking at all elements, because this is a multi-pronged process. We have different stakeholders. We have sister departments, social development, Department of Health, and NGOs like SADC and teddy bear clinic. So we involve everyone just to make sure that we work in synergy, work together. Also include the members of the community, SGBs, like as we've already indicated. So the program will be detailed to say what is it that we'll be doing in the near future and on a continuous basis, just to make sure that our children are safe at all times when they are in our environment.
Now, in a meeting that was held in Sakane that was facilitated by our department, we remember that parents raised concerns of mental issues that these children could possibly be facing. Now, we want to understand, as a department, how are you providing, mental help to those children in particular?
Now, like as I've indicated, our program is multi-pronged. We have involved the Department of Health. They will be playing a significant role. SADC as well, the teddy bear clinic. All our stakeholders will be working very closely with them. Hence we've invited them to be here today as well, to also give them an opportunity to talk about some of their, processes, and also make sure that the 116 number, it's well known. Learners, children, parents can also access that, and professionals are always available on that childline number, so that they are vet, taking their lives. They are vet, doing things that probably will not assist them in the near future, and their safety is quite a concern, for us. So we must just make sure that we work, in synergy with the partners, make sure that we change the situation that we are facing, which is dire.
Thank you very much for your time. So now, you'd understand that according to the World Health Organization, now suicide is regarded as, a major health issue that really has to be responded to by different relevant departments, as it's something that has been happening, quite a lot, especially in schools. Now, today is all about, raising awareness, telling governments and also organizations on how they could possibly assist individuals to help curb the spread, or rather the increasing rate of suicide cases, not only in learners and also other people in communities. We were also told that later on the MEC will also be giving an update, on the learner placements of the province. Back to you in studio.
Thank you very much, Zola Sholwana.